Listen to me. You're under arrest. Get ready to stand up.
Please.
It's 20 minutes. They're getting chemo.
No, she's sick. You can't do this.
Ma'am, step back now. This treatment stops. She's coming with us.
The IV drip was almost finished. Just 20 more minutes and Carmen Rodriguez would complete her third round of chemotherapy treatment. She sat quietly in the hospital chair, her mother holding her hand, both of them watching the clear liquid slowly make its way through the tube that would hopefully save her life. The oncology ward was peaceful that Tuesday afternoon, filled with the quiet sounds of machines beeping and nurses moving between patients with gentle voices and careful steps. Carmen had been fighting lymphoma for 8 months. At 26 years old, she was determined to beat this disease and return to her job as an elementary school teacher. Her students had made her cards that covered the walls of her small apartment, colorful drawings with messages like, "Get well soon, Miss Rodriguez," and "We miss you." She carried those cards with her to every treatment, a reminder of why she needed to keep fighting. What Carmen didn't know was that 3 men in dark suits were walking through the hospital corridors at that very moment, asking questions at the front desk and showing badges to security guards. They had been tracking her for weeks, waiting for the right opportunity, and they had decided that this moment, while she was vulnerable and connected to life-saving medication, was their perfect chance. But these agents were about to make a decision that would destroy their careers, humiliate their agency, and cost taxpayers millions of dollars. Because Carmen Rodriguez wasn't just any patient, she was about to become the woman who would change immigration enforcement in hospitals forever. Carmen had come to the United States when she was 3 years old with her parents, who were fleeing violence in their home country. She grew up in a small town in Texas, spoke perfect English, graduated high school with honors, and put herself through college by working nights at a local diner. She had applied for legal status multiple times through various programs, but the immigration system moved slowly and her applications kept getting delayed or denied on technical grounds. When she was diagnosed with cancer, Carmen qualified for emergency Medicaid, which allowed her to receive treatment at the county hospital. She never tried to hide from authorities. She paid her taxes every year using an individual taxpayer identification number. She volunteered at her church and helped elderly neighbors with their grocery shopping. She was exactly the kind of person most Americans would want as their neighbor. The 3 ICE agents who entered the hospital that day had a different perspective. Agent Robert Sullivan had been with immigration enforcement for 12 years and prided himself on meeting his quota of arrests every month. His supervisor had been pressuring the team to increase their numbers, and hospital visits had become a favorite tactic. Sick people couldn't run. Sick people were easy targets. Agent Sullivan had received a tip from someone at the hospital, though he never verified whether this person had any authority to provide patient information. The tip was simple. There was an undocumented woman receiving expensive cancer treatment on the taxpayer's dime, and she would be there every Tuesday and Thursday afternoon for the next 6 weeks. What the tipster didn't mention, and what Agent Sullivan didn't bother to investigate, was that Carmen had pending applications for relief that should have protected her from removal during her medical treatment. She had hired an immigration attorney who had filed several motions with the court, including a request for prosecutorial discretion based on her medical condition. These documents were public record. A simple database search would have shown that Carmen was not someone who should be arrested. But Agent Sullivan wasn't interested in complicated legal research. He was interested in easy arrests that would look good on his monthly report. The agents took the elevator to the 3rd floor oncology unit. They approached the nurses' station and flashed their badges, asking about Carmen Rodriguez. The head nurse, a woman named Rebecca, who had been caring for cancer patients for 15 years, immediately felt something was wrong. She had never seen immigration agents in the hospital before, and the timing seemed deliberately cruel. Rebecca tried to explain that the patient was in the middle of receiving chemotherapy, that interrupting treatment could be dangerous, and that surely this could wait until after her session was completed. Agent Sullivan told her that was not her decision to make. He asked which room Carmen was in. Rebecca made a choice that would later save her job and earn her recognition from patient advocacy groups. She told the agents that she needed to check with hospital administration before providing any patient information. She walked them to a small conference room and asked them to wait while she made some calls. The first call Rebecca made was to the hospital's legal department. The second call was to her supervisor. The third call was to hospital security. Within 10 minutes, she had been told by 3 different people that the hospital had policies protecting patients during active treatment, that immigration enforcement was not permitted in patient care areas without proper legal documentation, and that security would escort the agents out if necessary. When Rebecca returned to the conference room, she informed Agent Sullivan and his team that they would need to provide a warrant or court order to access any patient information, and that they could not enter patient care areas without following proper protocols that included notification of hospital administration and coordination with medical staff. Agent Sullivan's response revealed everything about his character and his disregard for both legal procedures and human decency. He told Rebecca that he didn't need her permission to do his job. He said that harboring illegal immigrants was a federal crime, and that she could be arrested for obstruction if she continued to interfere. This was a lie. Rebecca was not harboring anyone. She was protecting a patient's right to receive medical care without harassment. But Agent Sullivan was used to intimidating people who didn't know their rights. What he didn't realize was that Rebecca had dealt with bullies before. She had worked in emergency rooms in rough neighborhoods. She had stood up to abusive family members who tried to interfere with patient care. She had faced down drunk patients and violent visitors. A federal agent throwing his weight around was nothing new to her. She looked Agent Sullivan in the eye and told him calmly that he was welcome to arrest her if he thought he had grounds to do so. But until he produced proper legal documentation, he would not be accessing any patient information or entering any patient rooms. Agent Sullivan made his second major mistake of the day. Instead of backing down, getting a warrant, or following proper procedures, he decided to go around Rebecca. He left the conference room and started walking through the oncology ward, looking for Carmen Rodriguez himself. The oncology unit was laid out in a long hallway with patient rooms on both sides. Most doors were open, and patients could be seen in various stages of treatment. Some were sleeping. Others were reading or talking quietly with family members. The atmosphere was peaceful, almost sacred. This was a place where people came to fight for their lives. Agent Sullivan walked slowly down the hallway, peering into each room. His 2 colleagues followed behind him, looking increasingly uncomfortable with the situation. Other patients and families began to notice these men in suits walking through the ward, and whispers started spreading from room to room. In room 314, Carmen was dozing lightly while her mother, Sophia, watched the IV drip. Sophia had taken time off from her job cleaning office buildings to be with her daughter for every treatment. She couldn't afford to miss work, but she couldn't bear the thought of Carmen facing this alone. Sophia saw the 3 men approaching and immediately felt afraid. She had lived in the United States for over 20 years, but she had never forgotten the fear that came with being undocumented. She gently shook Carmen's shoulder to wake her up. Carmen opened her eyes and saw her mother's worried face. Then she saw the 3 men standing in her doorway. Agent Sullivan stepped into the room without invitation and asked if she was Carmen Rodriguez. Carmen's training as a teacher kicked in. She had dealt with difficult situations before. She remained calm and asked who was asking. Agent Sullivan showed his badge and told her she was under arrest for immigration violations. Carmen looked at the IV tube in her arm, at the machine monitoring her vital signs, at her mother's terrified face. She told the agent that she was in the middle of medical treatment and asked if this could wait until it was finished. Agent Sullivan told her it could not wait. He said she needed to come with them immediately. This was the moment that would define the entire case. Carmen was not resisting arrest. She was not trying to flee. She was asking for 20 more minutes to complete life-saving medical treatment. Any reasonable person would have granted this request. Any decent human being would have shown compassion for someone fighting cancer. Instead, Agent Sullivan reached over and began disconnecting Carmen's IV line himself. He was not a medical professional. He had no training in handling medical equipment. He had no idea what medication was flowing through that tube or what the consequences might be of stopping it abruptly. He simply yanked the tube out of Carmen's arm, causing blood to drip onto the hospital bed. Carmen cried out in pain and shock. Her mother jumped up from her chair, pleading with the agents in Spanish and broken English to please let her daughter finish her treatment. The heart monitor began beeping rapidly as Carmen's stress levels spiked. Nurses came running from down the hall. Rebecca arrived within seconds, took one look at the scene, and immediately called for security and hospital administration. She began checking Carmen's vital signs while demanding that the agents step back and allow her to provide medical care. Agent Sullivan told Rebecca that Carmen was now in federal custody and that any medical care would need to be provided at the detention facility. Rebecca explained that stopping chemotherapy treatment abruptly could have serious medical consequences, that Carmen needed to be monitored for potential reactions, and that she required immediate medical attention for the bleeding at her IV site. The agent dismissed these concerns. He pulled out handcuffs and told Carmen to stand up. Carmen, still dizzy from the interrupted treatment and traumatized by what was happening, tried to comply, but her legs were weak and she stumbled. Her mother reached out to steady her, and Agent Sullivan roughly pushed Sophia away, telling her not to interfere with a federal arrest. Sophia, a small woman in her 50s, nearly fell backward into the medical equipment. This was when other patients and families in nearby rooms began to react. An elderly man receiving treatment in the next room started shouting for someone to call the police. A woman across the hall began recording on her phone. Children visiting their sick relatives started crying. The peaceful healing environment of the oncology ward had been transformed into a scene of chaos and trauma, all because 3 federal agents had decided that their arrest quotas were more important than basic human decency. But Agent Sullivan wasn't done making mistakes. His worst decision was yet to come. Yet to come. Hospital security arrived within minutes, but they found themselves in an impossible situation. The head of security, a former police officer named David, had never dealt with federal agents conducting an arrest in a patient care area. He radioed for backup and tried to understand what was happening while chaos erupted around him. Agent Sullivan demanded that hospital security assist with the arrest. David refused, explaining that his job was to protect patients and maintain order in the hospital, not to help with immigration enforcement. This refusal infuriated Sullivan, who threatened to have David arrested for obstruction of justice. Meanwhile, Carmen was growing weaker by the minute. The interrupted chemotherapy had left her system in distress, and the stress of the arrest was causing her blood pressure to spike dangerously. Rebecca, still trying to provide medical care, kept pleading with the agents to allow her to stabilize her patient before any transport occurred. Dr. Elizabeth Harper, the oncologist overseeing Carmen's treatment, had been called from another floor and arrived to find her patient in handcuffs while still bleeding from the IV site. Dr. Harper had been practicing oncology for 22 years and had never seen anything like this. She immediately began documenting everything she witnessed, knowing that this violation of medical ethics would need to be reported to multiple authorities. Dr. Harper approached Agent Sullivan and identified herself as the attending physician. She explained in clear medical terms that Carmen's treatment had been interrupted at a critical point, that her immune system was compromised from the chemotherapy, and that transporting her to a detention facility without proper medical monitoring could be life-threatening. Agent Sullivan's response showed his complete disregard for medical expertise. He told Dr. Harper that the detention facility had medical staff who could handle any problems. Dr. Harper explained that detention facility medical staff were not trained in oncology and would not have access to Carmen's treatment protocols or medical history. The agent said that wasn't his problem. This callous response was overheard by multiple witnesses and would later become a key piece of evidence in the lawsuit. Dr. Harper continued to advocate for her patient, explaining that Carmen needed immediate blood work to check her white cell count and liver function, that she required anti-nausea medication to prevent severe side effects, and that her next treatment session would need to be rescheduled carefully to maintain the effectiveness of her cancer therapy. Agent Sullivan ignored every word of medical advice and ordered his colleagues to escort Carmen out of the hospital immediately. As they walked Carmen down the hallway, still in handcuffs and wearing her hospital gown, other patients began to react with horror. Several people called out asking if someone was calling the police. Others demanded to know why a cancer patient was being arrested. The scene was being recorded by multiple witnesses on their phones. Carmen's mother, Sophia, followed behind the group, crying and begging the agents to let her daughter get dressed and gather her belongings. Her purse, her phone, her insurance cards, and her medication were all still in the hospital room. Agent Sullivan told Sophia she could collect those items later and that she needed to stay away from the arrest. Sophia asked if she could follow them to wherever they were taking Carmen. She asked if she could call a lawyer. She asked if Carmen would be able to continue her cancer treatment. Agent Sullivan answered none of these questions. He simply kept walking toward the elevator. The elevator ride down to the first floor was witnessed by a hospital social worker who had been called to assist. The social worker, named Jennifer, had experience helping patients navigate difficult situations, but she had never seen anything like this. She tried to speak with Carmen, asking if there was anyone she needed to call or anything the hospital could do to help. Agent Sullivan told Jennifer to stop talking to the prisoner. Jennifer replied that Carmen was still a patient of the hospital until she left the building and that she had a right to social services. This led to another argument between hospital staff and the agents, with Jennifer insisting on patients' rights and Sullivan threatening to arrest her for interference. When the elevator doors opened on the first floor, news of what was happening had already spread throughout the hospital. Staff members lined the hallways, many of them openly staring in disbelief. Some were taking pictures. Others were making phone calls. The hospital's public relations department was already fielding calls from local media who had been tipped off by witnesses. Outside the hospital entrance, Agent Sullivan's colleagues had a van waiting. Carmen was placed in the back of the vehicle while still wearing her hospital gown and slippers. She had no coat, no personal belongings, and no idea where she was being taken. The temperature that day was 42 degrees, and Carmen began shivering immediately. Sophia ran outside and begged to give her daughter a jacket. Agent Sullivan refused to allow this simple act of compassion. He told Sophia that if she continued to interfere, she would be arrested as well. Sophia stepped back, crying and helpless, as the van pulled away with her daughter inside. The drive to the detention facility took 45 minutes. During that time, Carmen began experiencing severe nausea and dizziness from the interrupted chemotherapy. She asked repeatedly to be taken to a hospital or to be allowed to call her doctor. The agents told her she could receive medical attention at the facility. When they arrived at the detention center, Carmen was processed like any other arrestee. She was fingerprinted, photographed, and given a standard medical screening by a nurse who had no oncology training. Carmen tried to explain her medical situation, but the intake process was rushed and the nurse barely listened. Carmen was assigned to a general population cell with 3 other women. She spent her first night in detention lying on a thin mattress, still feeling sick from the interrupted treatment, and wondering if she would ever see her family again or if she would be able to continue fighting her cancer. Meanwhile, back at the hospital, Dr. Harper was working late into the evening to document everything that had happened. She contacted the American Medical Association, the hospital's legal department, and the state medical board to report what she considered a serious violation of medical ethics and patient rights. Rebecca filed her own incident report, detailing how the agents had refused to follow hospital protocols and had physically disconnected medical equipment without any medical training. The hospital's administration began reviewing their policies and consulting with lawyers about their obligations to protect patients from this kind of harassment. Sophia spent that night calling every number she could find, trying to locate her daughter. Immigration attorneys, advocacy groups, and legal aid societies all told her the same thing. Carmen had rights, and what had happened to her was likely illegal, but getting her released quickly would be difficult. The story began to spread on social media that evening. Hospital staff who had witnessed the arrest shared their accounts online. Videos taken by other patients and families started appearing on various platforms. Within 24 hours, the hashtag Justice for Carmen was trending locally. Local news stations picked up the story and began investigating. They interviewed Dr. Harper, who spoke carefully but clearly about the medical dangers of interrupting cancer treatment. They spoke with Rebecca, who described the agent's refusal to follow hospital protocols. They interviewed other patients who had witnessed the arrest and were traumatized by what they had seen. The story caught the attention of immigration rights groups, medical ethics organizations, and civil liberties lawyers. Within 48 hours, Carmen had more legal representation than she had ever imagined possible. But while advocates were mobilizing on the outside, Carmen was deteriorating on the inside. The detention facility's medical staff had no experience managing cancer patients. They didn't understand her medication schedule, her dietary restrictions, or the signs of infection that could be life-threatening for someone with a compromised immune system. Carmen's white blood cell count, which should have been monitored daily after her chemotherapy treatment, was not checked for 3 days. When it was finally tested, the results showed dangerous levels that required immediate medical intervention. The facility's doctor recommended that Carmen be transferred to a hospital, but that recommendation sat on a supervisor's desk for another 2 days while bureaucratic procedures played out. During this time, Carmen developed a fever and began showing signs of neutropenia, a potentially fatal condition where the body cannot fight off infections. Her mother, Sophia, called the detention facility multiple times each day, begging to speak with someone who could tell her about her daughter's condition. She was told repeatedly that medical information could not be shared with family members. Sophia contacted every elected official she could think of. She called the mayor's office, the governor's office, and both of her senators. She spoke with immigration advocacy groups who began organizing protests outside the detention facility. She gave interviews to anyone who would listen, describing her daughter's medical condition and pleading for her release. The pressure began to build on ICE officials to justify why a cancer patient had been arrested during medical treatment. The agency's initial response was defensive, stating that immigration law applied to everyone, regardless of their medical condition. They claimed that Carmen had been treated appropriately and was receiving adequate medical care. This response backfired spectacularly when medical records from the detention facility were leaked to the press, showing that Carmen's condition had deteriorated significantly and that she had not received appropriate oncology care. The records showed that facility staff had been recommending her transfer to a hospital for days, but that those recommendations had been ignored by administrative officials. Public outrage intensified when it was revealed that Agent Sullivan had a history of controversial arrests. Immigration advocacy groups filed Freedom of Information Act requests and discovered that Sullivan had been the subject of multiple complaints over the years, including allegations of excessive force and targeting of vulnerable individuals. One particularly damaging revelation was that Sullivan had previously arrested a pregnant woman during a prenatal medical appointment, and another incident where he had arrested an elderly man during dialysis treatment. A pattern was emerging of an agent who seemed to deliberately target people when they were most vulnerable and least able to resist. The case began attracting national attention when prominent politicians started commenting on it. Several members of Congress called for an investigation into ICE's policies regarding arrests in medical facilities. Medical organizations issued statements condemning the interruption of cancer treatment for any reason other than medical emergency. Carmen's legal team, now led by a prominent civil rights attorney named Sarah Chen, filed multiple motions demanding her immediate release on medical grounds. They argued that her continued detention violated her constitutional rights and put her life at risk. They presented evidence from Dr. Harper and other medical experts showing that delays in cancer treatment could be fatal. The government's response to these motions was telling. Rather than defending the arrest on its merits, prosecutors focused on technical legal arguments about jurisdiction and proper procedures. They seemed reluctant to argue that arresting a cancer patient during chemotherapy was appropriate or necessary. Judge Patricia Williams, who was assigned to hear Carmen's case, was known for her careful attention to detail and her protection of constitutional rights. During the first hearing, she listened to medical testimony about Carmen's condition and the risks of continued detention. She asked pointed questions about why the arrest could not have waited until after the medical treatment was completed. The government's attorney struggled to provide satisfactory answers. When pressed by the judge, he admitted that there had been no urgent threat requiring Carmen's immediate arrest, and that agents could have waited outside the hospital and arrested her after her treatment was finished. Judge Williams asked why ICE had policies allowing arrests in medical facilities during active treatment. The prosecutor said he was not familiar with those policies. The judge ordered the government to provide all relevant policy documents and to justify why a cancer patient's medical treatment had been interrupted. While these legal proceedings were taking place, Carmen's health continued to decline in detention. She had missed 2 scheduled chemotherapy appointments, throwing her entire treatment protocol off schedule. Her oncologist submitted multiple reports to the court explaining that delays in cancer treatment could allow the disease to progress and could require more aggressive interventions later. The detention facility was clearly unprepared to handle Carmen's medical needs. She was not receiving proper nutrition for a cancer patient, was not getting adequate rest due to the facility's schedules and noise levels, and was under constant stress that compromised her immune system's ability to recover from treatment. After 2 weeks in detention, Carmen collapsed in her cell and was rushed to a local emergency room. Hospital tests showed that her cancer markers had increased and that her immune system was severely compromised. Emergency room doctors recommended immediate hospitalization and resumption of chemotherapy. This medical emergency finally forced ICE officials to make a decision they had been avoiding. They could not justify keeping a deteriorating cancer patient in detention when medical experts were saying her life was at risk. Carmen was released on medical parole pending her immigration hearing. The reunion between Carmen and her mother at the hospital was emotional and heartbreaking. Sophia had not been allowed to see her daughter for 2 weeks and was shocked by how much weight Carmen had lost and how weak she appeared. Carmen was immediately readmitted to the oncology unit where her nightmare had begun. But now she was fighting not just cancer, but also the setbacks caused by the interruption in her treatment. Dr. Harper had to completely restructure Carmen's treatment plan. The delays had allowed some tumor growth, and Carmen's weakened condition meant that more aggressive chemotherapy would be riskier. What should have been a straightforward treatment protocol had become a complex medical challenge with uncertain outcomes. Dr. Harper's revised treatment plan required Carmen to essentially start over with a more intensive chemotherapy regimen. The 2-week interruption had given the lymphoma time to adapt and grow stronger. What should have been her 4th treatment session had now become a restart of her entire protocol, with higher doses and greater risks to her already compromised immune system. Carmen's legal team was documenting every aspect of her medical setbacks. Sarah Chen, her lead attorney, brought in medical experts who could quantify exactly how the arrest had damaged Carmen's health outcomes. Dr. Michael Roberts, an oncology specialist from Johns Hopkins, reviewed Carmen's case and provided a devastating assessment of how the detention had impacted her prognosis. Dr. Roberts explained that cancer treatment timing is critical, especially for aggressive lymphomas like Carmen's. Every day of delay allows cancer cells to multiply exponentially. The stress of detention, poor nutrition, and lack of proper medical monitoring had created what he called a perfect storm of factors that could have long-term consequences for her survival chances. The medical evidence was building a powerful case, but Sarah Chen knew that proving damages in court would require more than just medical testimony. She needed to show that Agent Sullivan and his colleagues had acted with deliberate indifference to Carmen's constitutional rights and medical needs. Chen's investigation into Agent Sullivan's background revealed a troubling pattern that went beyond the few cases that had already been reported. Through Freedom of Information Act requests and interviews with former colleagues, she discovered that Sullivan had built his career on targeting vulnerable people who couldn't fight back effectively. A former ICE agent named Kevin Martinez came forward with damning testimony about Sullivan's methods. Martinez had worked with Sullivan for 3 years before requesting a transfer because he couldn't stomach the aggressive tactics. He described how Sullivan would specifically look for people in hospitals, schools, and other locations where they would be most vulnerable and least likely to resist arrest. Martinez testified that Sullivan had once bragged about arresting a diabetic man during insulin treatment, saying it was easier than chasing someone through the streets. He described Sullivan's philosophy as finding people when they were weak and taking advantage of their inability to flee or fight back. The testimony revealed that Sullivan's supervisors were aware of his tactics, but had never disciplined him because his arrest numbers were consistently high. In the ICE field office where Sullivan worked, quantity mattered more than quality or humanity. Agents were evaluated primarily on how many people they arrested, not on whether those arrests were appropriate or legally sound. This institutional culture became a central focus of Carmen's lawsuit. Chen argued that ICE had created a system that incentivized agents like Sullivan to target vulnerable people, and that the agency was therefore liable for the constitutional violations that resulted from this approach. The government's legal team, led by federal prosecutor James Bennett, initially tried to defend Sullivan's actions as within the scope of his authority. Bennett argued that immigration law gave agents broad discretion to make arrests, and that medical facilities were not exempt from immigration enforcement. This defense strategy began falling apart when Chen presented evidence of ICE's own internal policies. The agency had guidelines that were supposed to protect sensitive locations like hospitals, schools, and churches from routine immigration enforcement. These policies stated that arrests in such locations should only occur in cases involving national security threats or serious criminal activity. Carmen clearly didn't fit either category. She was a cancer patient with no criminal history who had been living peacefully in the community for over 2 decades. The government struggled to explain why Sullivan had violated his agency's own policies by conducting the arrest in a hospital during medical treatment. Judge Rebecca Anderson, who was now overseeing the federal civil rights lawsuit, ordered discovery that would reveal the full extent of ICE's policies and Sullivan's training. The judge wanted to understand whether Sullivan had acted as a rogue agent or whether his behavior reflected broader institutional problems. The discovery process revealed shocking details about the lack of training ICE agents received regarding medical situations and constitutional rights. Sullivan had never received any training on the risks of interrupting medical treatment. He had never been taught to recognize when someone might be in medical distress. He had never learned about the special protections that should apply to vulnerable populations. More damaging was the revelation that Sullivan's field office had a quota system that pressured agents to make a certain number of arrests each month. Agents who failed to meet their numbers faced negative performance reviews and limited promotion opportunities. This created an environment where agents felt pressure to arrest anyone they could find, regardless of the circumstances. Internal emails between Sullivan and his supervisors showed that the hospital arrest had been discussed and approved in advance. Sullivan's supervisor, District Director Robert Hayes, had not only known about the planned arrest, but had specifically suggested targeting Carmen during her medical treatment because she would be unable to flee. These emails became the smoking gun in Carmen's case. They showed that the decision to arrest her during chemotherapy was not a split-second judgment call by a field agent, but a calculated strategy approved at the supervisory level. The emails revealed a callous disregard for Carmen's medical condition and basic human dignity. Public outrage reached new heights when these internal communications were leaked to the media. Immigration advocacy groups organized protests outside ICE field offices in multiple cities. Medical professionals held demonstrations outside hospitals, demanding protection for patients receiving treatment. The American Medical Association issued an unprecedented statement calling for federal legislation to protect medical facilities from immigration enforcement. The statement, signed by thousands of doctors nationwide, argued that patients must be able to seek medical care without fear of arrest, and that interrupting treatment for non-emergency reasons violated fundamental medical ethics. Carmen's story had become a symbol of immigration enforcement gone wrong. Her case was featured on national news programs where medical experts explained the life-threatening risks of interrupting cancer treatment. Immigration attorneys used her case to illustrate the need for reform in ICE policies and practices. The political pressure began affecting ICE leadership at the highest levels. Congressional oversight committees announced investigations into the agency's arrest practices in sensitive locations. Several prominent senators called for Director Hayes to be fired and for Agent Sullivan to face criminal charges. Meanwhile, Carmen was struggling through her revised treatment protocol. The higher doses of chemotherapy were causing severe side effects that she hadn't experienced during her original treatment plan. She was hospitalized twice for complications related to her weakened immune system. The stress and trauma of her arrest seemed to be making her body less responsive to treatment. Dr. Harper documented every setback, every additional hospitalization, every complication that could be traced back to the interruption in Carmen's care. The medical evidence was building a compelling case that the arrest had not only violated Carmen's rights, but had also materially worsened her health outcomes and reduced her chances of survival. Sarah Chen was preparing for a trial that would put ICE's entire culture and practices on display. She had medical experts ready to testify about the specific harms caused by the arrest. She had former ICE agents willing to describe the agency's problematic quota system and lack of training. She had internal documents showing that supervisors had approved targeting a cancer patient during treatment. The government, facing mounting evidence and public pressure, began exploring settlement discussions. Federal attorneys reached out to Chen's team to discuss the possibility of resolving the case without a trial. But Carmen and her legal team were not interested in a quiet settlement that would allow ICE to avoid accountability. Chen made it clear that any resolution would need to include significant policy changes to prevent similar incidents from happening to other patients. She demanded that ICE implement new training for agents about medical situations, create real protections for sensitive locations like hospitals, and establish oversight mechanisms to prevent agents from targeting vulnerable populations. The settlement negotiations revealed how seriously the government was taking the case. Federal attorneys acknowledged that the arrest had been problematic and that changes were needed in ICE policies. But they were reluctant to admit legal liability or to agree to the broad policy reforms that Carmen's team demanded. As the negotiations continued, Carmen's case continued to attract national attention. Documentary filmmakers began following her story. Academic researchers studied her case as an example of the intersection between immigration enforcement and healthcare access. International human rights organizations cited her treatment as evidence of systematic problems in U.S. immigration enforcement. The case was also inspiring legislative action at various levels of government. Several states passed laws explicitly protecting patients in medical facilities from immigration arrests. Cities and counties adopted ordinances declaring hospitals to be sanctuary spaces where immigration enforcement would not be tolerated. Carmen herself had become a reluctant advocate for immigration and healthcare reform. Despite her ongoing battle with cancer, she began speaking publicly about her experience when her health allowed. Her testimony before a congressional subcommittee was particularly powerful, as she described the fear and trauma of being arrested while fighting for her life. Carmen's story resonated with people across political lines because it touched on fundamental questions of human dignity and compassion. Even those who supported strict immigration enforcement struggled to justify arresting a cancer patient during treatment. Her case had exposed the human cost of immigration policies that prioritized enforcement over basic humanity. The medical community had rallied around Carmen's case in unprecedented ways. Oncology nurses who had never been involved in political advocacy began organizing to protect their patients. Hospital administrators started reviewing their own policies and training security staff to better handle situations involving federal agents. Dr. Harper had become a vocal advocate for patient protection, speaking at medical conferences about the need for healthcare providers to stand up for their patients' rights. She described how Carmen's case had changed her understanding of her role as a physician, making her realize that advocating for patients sometimes meant confronting federal agents who were violating medical ethics. The ripple effects of Carmen's case were being felt throughout the healthcare system. Other patients who had been afraid to seek treatment because of their immigration status began coming forward, knowing that medical professionals were fighting to protect them. Hospitals began developing protocols for dealing with immigration enforcement that prioritized patient safety and medical ethics. But the most important outcome was still pending. Carmen's lawsuit against Agent Sullivan, his supervisors, and ICE was scheduled for trial, and the resolution of that case would determine whether there would be real accountability for what had happened to her. The trial would also set precedents that could protect countless other patients from similar violations of their rights and dignity. Other patients from similar violations of their rights and dignity. The trial lasted 3 weeks and ended with a jury verdict that stunned legal experts nationwide. Carmen Rodriguez was awarded $18 million in damages, with the jury finding that Agent Sullivan, his supervisors, and ICE had violated her constitutional rights through deliberate indifference to her medical needs and basic human dignity. Agent Sullivan was terminated and faced federal criminal charges for deprivation of rights under color of law. His supervisor was demoted and transferred, while the entire field office underwent mandatory retraining. But the real victory wasn't measured in dollars. ICE implemented sweeping policy changes that protected patients in medical facilities from non-emergency arrests. Hospitals across the country adopted new protocols to shield vulnerable patients from harassment. And Carmen, though her cancer battle became more difficult because of the arrest, eventually achieved remission and returned to her classroom, where her students welcomed her back with new drawings that said, "Welcome home, Miss Rodriguez." Her case became a landmark in civil rights law, cited in courtrooms and medical ethics textbooks as an example of what happens when enforcement priorities override basic humanity. Carmen proved that even the most vulnerable among us can fight back when the system fails them, and that sometimes one person's courage to stand up for what's right can change everything. If you think this situation was bad, wait until you see what happens in the case on the right-hand side.